Welcome to JADEL TV. This is a video I recently posted of a patient with bacterial endocarditis of the mitral valve. Number of complex features that make this a little bit atypical is the bulky mass, the involvement of the myocardium itself, where you can see there's a sort of echo-free space right underneath this large bulky mass on the posterior leaflet. And you can see there's a intermediate-sized pericardial effusion, which is always a poor prognostic sign, actually, in patients, usually with endocarditis from intravenous drug use, and oftentimes younger patients presenting with an intermediate to large pericardial effusion is a very high mortality sign. A lot of people, I think, pointed out this echo bright region here in the posterior AV groove. That's a pretty common pattern of fat. Some people call it a lipid globule or a fat globule. Can often be seen on transthoracic or transesophageal echocardiogram. And every time you have a pericardial effusion, it becomes more visible because the borders are now well defined. But it's just a benign finding and not related to the infection in this case. The other comment that was made was ventricular function, and I think it's important to point out that in a patient with severe mitral regurgitation, this ejection fraction should be slamming away. Calculated ejection fraction was 58%, which is another very severe marker and a likelihood that the valve, after it's repaired, would not be associated with recovery of ventricular function. You need to have an ejection fraction over 16% and a global longitudinal strain over 20%, both of which were reduced in this case. So just a very complex endocarditis of the mitral valve with multiple features suggesting poor prognosis. Hope you enjoyed that case discussion.